practical psychology counseling book, we will do history taking chapter. What is the most important quality of a counselor? So there are two answers. One is a theoretical answer. You should have empathy, sympathy, all those things. No, people don't want sympathy. And if you empathize with people, so you are putting yourself in the shoes of someone who is sad and depressed. So you are going to feel their emotions. And then you are not strong enough to manage them. No. So what is the most single important quality of a good counselor? Write on the chat. Smile. If you are smiling, you don't need anything else. So listening is not sufficient. You have to communicate also. Many people I have seen counselors, they are like the client is talking and they are listening and making the notes to show them that they are listening. Or they are like, hmm, 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 hmm. What is this? It has to be a conversation. It has to be a friendly conversation. It has to be a dance. So the client is telling their story, you are asking question, you are provoking them more questions. You are asking the name in the stories, the events of the stories, approximate days, the relation of the people with them. So it has to be more of an interaction. So smile and interaction. Right? Do not write the notes when the client is talking. Right? You will have to develop that skill that you will need to learn and remember the names, events, the story of the client. That skill you will need to develop. Once you manage around 10-20 clients, slowly that skill will start developing. So don't think this as a client. Think it as a friend who is gossiping about her sad life. And you are enjoying it so much because you now know that she's sad and she's your friend. So enjoy that and remember all the stories. Obviously, this friend is a paid friend. I mean, she's paying you the money to listen to her sadness. Number one step is will be about the client. So who are you? What are you? What you do? What is your profile? So start with the name, right? So if you are typing something on the chat, WhatsApp with the client, or you're talking to the client, it has to be with the name. It cannot be something, madam, uncle, sir, no, beta, no. It has to be always with the name of the client. So whatever is the age of the client doesn't matter. They might call you ma'am, it's okay. They might call you by name, that is also okay. No problem. So name of the client, what is their educational background, what is their profile, what kind of work they are doing, in which city they are living. So this breaks the ice, this opens up them. And then come to the family history and certain disease history, or typically uh, how is their life about overall. When you say how is your life about, then they will come to the next point. So before they come to the next point, also talk about you. So your introduction is very important. Most of the clients, they will do the window shopping. They will talk to one counselor, then next week, next month, they will talk to another counselor, but they will take a pause of 1 year, leave like a zombie, then again approach another. So among all this window shopping, you have to be remembered. Okay, just a second. iPhone, you join with your name and you're distracting so much, you're talking on another call. Okay, forget this. Talk about yourself. What is your name? They must register your name. And you enforce them to save your number with your name. Most of the clients will save like counselor 1, counselor 2, counselor 100. So, hello. My first rule is you have to save my name so that you remember me, who am I, what am I. So you can say with the counselor word and then my name, that is okay. But my name you should remember. I don't want this interaction like a salesperson. I don't want this telecaller role. No. You must know who am I. Then you introduce about your qualification, what you have studied. You have studied about the practical approach of counseling for every condition. We do not call it psychological condition, we call it emotional turbulence because that is a friendly word. And I have learned diagnostic symptoms, medicine side effects, how to actually talk to the client, what will be your expected questions and how I will answer best, and how to actually manage the clients. So I have learned all these things. So they know that it is not going to be just history taking, it is not going to be something one person is talking and you are like doing ha 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 and telling them, giving them some sheet and telling them you do this assignment, start writing the diary. No one is writing the diary. See, these are depressed people, these are anxious people. If they could have controlled their life, they also somewhere know what they should do for their betterment, but they are not able to do because they are affected by that condition and they have started romanticizing it. Someone who is depressed, they romanticize depression. Someone who is anxious and worried, they feel prestige in worrying and thinking further and further, right? So you cannot just tell them to do something, some steps. It has to be multiple things. It has to be a particular talk. It has to be planning. So at the end of the session, you have to make some plan for them. What is the next step? So that they know that next time it is not going to be again only listening and so introduce yourself in 30 seconds, your name, your educational background, and what have you learned and how is your approach, what you have been doing. So you can say your about experience that you have been managing your clients and most of your clients, they get better. If you have done psychotherapy course, you can mention that I'm a psychotherapist and I know certain methods which are copyright method and I will use those methods on you. They can be done on online session also and I guarantee you that you will get healed. Your trauma will get erased. Your traumatic memories will get replaced. I guarantee you, your willpower will increase. Your threshold for emotional pain will increase. I guarantee you. If I don't do that, I will refund you the money. And I will help you make a systematic plan for next 3 months, 6 months. Maybe you might have gone to other counselors who just talk. But I will talk, I will listen, I will tell you what to do, and I will do certain methods for you to heal you completely, permanently. I don't want you to suffer and shift on, keep on switching your clients. We are assuming that before all these steps, you already collected their fees. Yeah. So there might be some client that they will say that I will take the session and they pay. They will never ever pay. They are either your competitors or just miscreants. They are looking, they want to check, hello, are you doing a proper work? They want to audit you, kind of. Yeah. So because they might have bipolar disorder, they are in the psychotic phase, they think themselves as a god, and today they want to audit you. So don't go for that. Now, then the third step will be client's emotional turbulence. What is the turbulence going on? What is emotional turbulence? So typically the client answers by one word like anxiety or depression or bipolar disorder, schizophrenia. They have done the Google or Chat GPT. So you have to tell them, instead of giving me the diagnosis, tell me the symptoms. What is happening? What is your issue? What is your emotional turbulence? Rather than giving me a psychological condition or diagnosis, tell me what are you facing? What is the difficulty happening? Then they start talking, right? Avoid the labels. Like they may say, give 2, 3 symptoms and then suddenly, oh yeah, classical bipolar, classical schizophrenia, you are hopeless, classical. Sometimes during their storytelling, they might say something which may be horrible for you, right? So they have killed someone, they have slapped someone, they have slept with someone. So don't be like, ooh. So it has to be, okay, things happen. It's good you're opening up, right? Because the first step to heal yourself is acknowledge your mistakes. See, someone who is a monster, a narcissist, they will never acknowledge their mistake and they will pretend to forget it. You remember it, you are feeling guilty, that's a good start. You can talk to me, I will not judge you. I'm not going to call you or someone, your wife or husband, to tell them that you have slept with 5 people. No, you tell me whatever is there. Okay. So at this stage, they might ask, have I done correct? Have I done wrong? So you say that is individual perspective. You have done that because you thought that is correct. According to me, it is wrong. So I'm not here to judge you, whether you did right or wrong. My objective is to help you overcome your guilt and move on your life. Presently, there is a dysfunction in your life, right? You are supposed to be happy, you are supposed to work, you are supposed to earn, you are supposed to have a good relation, but some of the factors, they are not happening. So my role is to improve those factors. So there are certain methods which I may be using for you, which will erase your traumatic memories, which will replace traumatic images. Then asked what are the symptoms. Typically here the client needs some help, right? In Sunday classes you also learn the worksheets which are used for the opening up the client or diagnosis of the client, those worksheets. So you can give them example of emotions: sadness, fear, guilt, shame, low self-esteem, denial, low self-worth. Whatever is happening, tell me frankly. When they tell it, you have to ask some examples, right? Why do you think this way? How frequently this has been happening? Whatever there is emotional turbulence, anxiety, stress, depression, insomnia, eating more, eating less, fighting more, irritability, anger. So these are all typical symptoms, right? And emotional condition will be the guilt, shame, and fear and all. So whatever is, so you ask them since how long it has been happening. So there might be a day in your life when you didn't have this. So go back to that event, go back to that crisis. Someone betrayed you, you did something horrible, some crisis happened, some traumatic event happened, then it started. Multiple events happened and they accumulated and then it started. Right? You may not be able to trace it back to a particular event because you were trying to suppress it. And then there was some trigger, something happened. Precipitating factor. So there might be some precipitating factor. You already had a guilt and shame of doing something wrong. And then one day you got fired from your job. So you're fired from your job was a precipitating factor. It is not an actual traumatic event. The traumatic event was before that. And probably because of that traumatic event, you changed, you became a bitter person, and that's why you got fired. You understand? So there is a trauma, there is a precedent factor, and then there are triggers. When do you face the most trouble? There might be certain days of the week, there might be certain months of the week. Is there a pattern? No, no pattern? Okay. So what is it that is triggering you? So someone does something, someone does not fulfill your expectation, you do something, you do not do something. What is it that is causing you trigger? So you are affected, depressed or stressed out, but suddenly there is a trigger. What happens? Tell me what happens. Who does it? So the place, the person, the time, event, circumstances, everything you will ask in this. And you will remember those events, circumstances, name of the person, relation of the person. So that next time when you communicate, you are able to communicate better. At this stage, you can just note down the name if you are not good in that. But don't write the complete history of the client. You are not a stenographer. How your daily routine looks like. What you do on a day-to-day basis. Before that traumatic event, before that precipitating event, how was your day looking like? So there is a drastic change. It means there is a dysfunction, right? You lost interest in the previously interestable activity, pleasurable activities. You lost your hobby. You lost your rituals. Yeah. You are not able to work. You are engrossed in your mobile. You are engrossed in porn. You are engrossed in promiscuous relation. You are engrossed in risky behavior. You are engrossed in anger, irritability, bitterness. What is it? What is happening? So what we have done is, at this time, we have reached around eighth step. We have reached in the history taking. At this time, we have identified what are the symptoms, what are the trigger factors that the symptoms increase. We have identified what is a precipitating factor. We have identified what is a trauma. Right? Now, the next part comes is about making a plan for the client. Before you make the plan for the client, ask them what are the questions you have asked me. It is also a good idea at this stage to ask whether they are taking some medications. There is a serious problem if someone is taking psychiatric medications. So the doctor has prescribed the psychiatric medications because the risks versus benefit, the benefit was higher for this particular client. But the client does not see the benefit early. The client will see the risk, the side effects early. So they may drop out. So you have to educate them. Two things. One, do not drop out from the medicines unless your psychiatrist does that. Second, at some point of time, you will have to stop these medicines. I will explain you how. And exactly you will explain like this. When your doctor has started psychiatric medications for you, so immediately there are side effects, and side effects are very high immediately, and slowly these side effects will decrease. The beneficial effect, it takes around 3 weeks to act, so you will not see the benefit but only the side effects for first 3 weeks, and after 3 weeks the beneficial effect will increase. But there is a serious problem. After few months, 4 months, 6 months, this beneficial effect will stop or start reducing because there is a plateau which has reached. Because there is a dependency now. Okay. So it is no longer working the same dose. So if you are taking 5 mg, you will need to increase the dose to 10 mg, which your doctor will do. But again, there is a problem. When you reach your 5 mg to 10 mg, your beneficial effect will take another 3 weeks to appear, and your side effects will double. The side effects which are decreased by this time, they are now again increased. Plus, there is no end how much dose you will need to increase, and since they cannot increase the multiple dose of the same medicine, they will add different type of medicine. When they add different type of medicine, one more medicine is added, one more or 4 more side effects are added. Right? And again, the new medicine also takes some time. Then after 1 year, 2 years, your life is only taking medicines, living with the side effect, increasing the dose, and you are acting as a zombie. Right? You are dead. 18 hours you are sleeping. Hey, what kind of life is that? Better is anxiety. Yeah, at least you were alive. Yeah. Better was depression. If you're taking up so many medicines that is causing you to sleep for 20 hours. Not a worth life. So you need to educate them that it is inherent in psychiatric medications that benefit will start after 3 weeks, side effects will start immediately and then decrease, but you will need to increase the dose further. That's because of this reason you need to continue your medications. Your doctor has given you the medications because the benefit is more than risks according to them for you. But since you cannot take these medications for lifetime and lot of side effects, plus you will be zombie, plus you will need to keep on increasing the dose or add multiple medicines, there has to be plan that you have to wean off, you have to stop your medications after 6 months, 1 year. That your psychiatrist cannot do, that I will do. As a counselor, as a psychotherapist, I will help you achieve that. You don't have a cancer, you don't have a fever, you don't have a viral fever, right? You don't have an infection. There is some chemical imbalance which has happened to your brain, and for that the medications are there. But remember, what was a time of your life when you were happy, when you were normal, when you were not so much affected what you are affected today. So we have to go back to that time. We have to find you again. So we have to heal those traumatic events. Now, how does the trauma stores? The trauma is not stored in letter or writings. It is stored in images. And that's why you get the flashbacks. The images will come. You are in a happy mood, you are in a happy event, but you get the flashback of the bad things. You are sleeping, you get the flashbacks. You are just sitting doing nothing, you get the flashbacks. If an event has occurred more than 6 months back and you are still getting the flashbacks awake, you have PTSD for that event. For PTSD, you don't need to go to war and become a soldier. If you are married enough, that is a strong reason for PTSD. If you are sleeping and you have nightmares of the event, flashbacks of the event, nightmares of the event, which has happened more than 9 months, that itself is a PTSD. So it needs healing. If you are living your life and you are taking your decisions, talking to people, you are responding, you are reacting, and deciding what to do next based on that event, you are traumatized. You are given up on your life. Someone has betrayed you, and now you have become the villain, or you have become bitter. So before you become the villain and bitter, there is going to be fight in you, whether I should become the villain or I should stay the hero. During this phase, healing can happen. Once you become bitter, once you become irritable person, very angry, and the healing takes time. It takes a lot of efforts, money. It takes you to come to me again and again. So educate the client that you are at this level. Educate the client at this level. No other counselor has talked to the client in this particular way and explained them so beautifully. So we have explained them about the medicine, and we have explained them about why there is a dysfunction in their life, why they are not happy, right? If you agree that your clients might not have seen other counselors talking in this way, write in the chat, agree. So if you are a client and I explain you all this, will you be happy? Yes, I want to take counseling from this counselor only. You understand? So the first session is more about winning the client. Now the traumas can be of three types. Not all trauma should be healed. Understand this part. While taking your history, you might come across certain history trauma which will be so horrible that the client themselves are not comfortable talking, and they have deep buried and moved on in their life. Some traumatic event happened. Now they got married and then moved on and everything. You don't need to open it up. No, no, I want to clean you. I want to heal you completely. You don't want that. Okay. So there are three types of trauma. The number one trauma, the client has moved on in their life and forgotten or deep buried. Do not touch this trauma. That is not affecting their life presently so much. It might be affecting if that trauma might not happen. But that trauma has defined her now. Nothing can be done. If you try to heal this trauma, open it up, it will cause psychological havoc. Yeah. Everything will flare up. Plus, if the client drops out because of this, then you are the monster of their life. You are killed someone. The second type of trauma is which is channelizing your energy. You were insulted, so you are doing something better. You were dumped by your boyfriend because you were fat and now you became thin and beautiful. Wow. You were rejected by your girlfriend because you were not rich and now you became rich. Right? So you were removed from some arts class, so you started Walt Disney. You were called a dumb child, so you won the Nobel Prize, right? Relativity theory and all those things, right? You were fired from your job, so you started your own company. You had a career break, people are taunting you. Instead of fighting with them, you are utilizing this to channelize your energy to learn and start helping and visualizing to help and earning money. So this type of trauma you should not heal. If someone says, sir, that person insulted me, absorb what you can from them. So you don't have to be a sponge. If you keep on absorbing all the insults, one day you will develop a cancer or you will die early. So you have to answer them back, whatever you want, whatever is your way. You have to kill them, you have to destroy them, whatever way is your. But take something out of it. So what should I do? Okay. But whatever you decide to do, don't do for them. That I want to show her. No. They don't care actually. And once you show them, they will be sad actually. So you decide to do it for yourself. I want to grow for myself, for my personal growth. I'm not a cow, I'm not a cattle, right? I'm a human being. I need to grow myself. I'm growing for myself. Those who choose counseling with the mindset that when you help someone that gives you happiness, they are the successful counselors. The money will come if you have this approach. I have seen some students who say, sir, I want to invest 20,000 and I want to earn lakhs. I say it will not happen. So whatever you have done, your graduation and masters, you have invested 5 years and maybe few lakhs, and after that also you are not earning anything, or maybe earning very less, and you're not satisfied. So you cannot try to make a second career in 20,000 and 6 months. There is no magic. This is the start of your career. You will need to learn something more. So if you do psychology counseling, marriage counseling, and psychotherapy, this combination will help you cross 60,000 to 1 lakh easily. Now there are two type of students. One is like she will go slow, 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 one, then second, then third. By the time she reaches the second or the third course, her passion is already gone, right? The fire is already dozed off. So if you have the kindles, if you have little sparks, you need to put all the fuel, all the energy, and in 6 months, gain your knowledge, take up the internship, and start something within a year. Keep a target to reach in next 2 years, whatever is your target of earning in next 2 to 3 years. You will need some systematic plan for that. So the third type of trauma, that trauma is causing dysfunction in present life. So dysfunction means not happy, not sleeping, fighting, irritable, not earning, not working, not enjoying the life, not fulfilling their hobbies or pleasures. That is dysfunction. So you need to identify the trauma, and then in Sunday classes you learn how to heal the traumatic memories, how to erase traumatic events, how to replace traumatic images with good images. You might have seen that there are some people who with the same event they are not affected so much. They are affected, but there are some other people with the same event they are affected very much. So that is a psychodynamics. So you need to do certain things to increase your emotional bank balance. So there are copyright methods which I teach in Sunday classes. After that you get the certificate of psychotherapist also. When you learn that, you will have a healing plan of 5 to 10 sessions. You have this emotional turbulence, you have these symptoms, you have this trigger factor, precipitate factor, and this trauma. I will work at the trauma level. I will work at precipitate factor. So that the next time same trigger happens, your response is different. That is neuroplasticity. So you are responding in a particular way, you are reacting in a particular way, you are taking your decisions on a particular way because based on that event, because your neurons are connected in this pattern. So there are methods that cuts your neuron, forms your new connection, and then your response to that trigger factor is different now, or your response is minimal. You are not affected so much. That is the healing part. I guarantee you, if you attend 6 sessions of the Sunday classes, you yourself will get healed, and you will start thinking, you will get the confidence. It is a 6 months program. You will get the confidence that you can heal someone completely permanently. You can guarantee them. You can tell them, I guarantee you, I will heal you completely permanently. You don't need to visit another counselor. You already won them by explaining them the medicines, the benefit risks, plus you explain them the 3 types of traumas, plus you explain them the concept of the turbulence, symptoms, triggers, precipitate factor, and trauma, right? And then you make their healing plan of 5 to 10 sessions. Typically, a client needs around 10 sessions, 1 or 2 sessions twice a week. And your always objective should be to heal them completely, permanently. Some people are like, sir, if they get healed, they will not come back. If they get healed, they will come back more. They will refer more clients because they are married. So they are going to get traumatized again. They are living in their life, which is unfair. So they are going to get traumatized again. They will come back to you again. Because others are only doing talking and you are using certain methods which are not available outside, which heals them. And they have found it. 80% benefit is also success. 50% is also success, Baba. Right? They were dying like a zombie. And they refer you more clients. And counseling, you can charge 1,000 rupees, 1,500 rupees per session. But with psychotherapy, you can charge 2,500 to 5,000 rupees per session. And clients are ready to pay. Because you are using certain method. There is an immediate effect for that. How many of you are attending Sunday classes and getting healed and Already healed, write down the chat. Getting healed, healed, whatever is your scenario. Started healing others, whatever stage of your healing is. Getting healed, healed, again traumatized, and then healed, and then started to help. Very good, I like this answer. So this is typically a 10-step history taking with the client. It starts with the client, it ends with the plan of future plan of 3 months, 1 month, 6 months, 10 sessions. If you're not learned psychotherapist, at least still you can tell them what to do. In every chapter in this book, every chapter is a condition, and for every condition you will learn 6 things: diagnostic symptoms, medicine side effects, how to talk to the client, what are their questions, and what is the best answer, how to actually manage the client. So before taking up the client, you are expected to read that chapter if you do not remember, and then tell them this management things you should do. You can make some notes and tell them and read from the notes also. So for every chapter there are around 10 to 25 tips what you should tell the client to do. Whichever is suitable for the client, you tell them. You can ask them, will you do that? Don't give them assignment like, I will give you assignment. Yeah, they are already afraid of assignments in the school time, and they don't want to do it anything. They want some magic. They want to come sit in front of you or maybe on laptop. They want you to do something that helps. They don't want to write the notes. They don't want to write the diary. I don't think that helps. Yeah. And are you writing your own diary? When you had your black days, were you writing the diary? No. You were enjoying, you were romanticizing your depression and anxiety, right? Worries. So everyone does that. They don't want to heal themselves. Understand the psychology. Someone who is having emotional turbulence, they know they are suffering. Probably someone has told them, or if they are educated, they also know how to come out of it. But the first step they don't take, the action they don't take, they don't want to do. And that someone, if comes to you, they have already used their lot of willpower to come to you for something. So your responsibility is to tell them the realistic scenario and how to heal them. Right? When you do counseling, you talk to them, listen them, tell them what to do. Then the responsibility is them. When you do psychotherapy sessions, responsibility is you. They come, they sit, you do certain methods, and they get healed. They feel better. The effect shows from the first session itself. Will they not pay? They will pay. Questions? Please ask the questions. Any question, silly question, foolish question, interesting question, any question, I will sincerely answer. Please ask. Don't hesitate. If you have a foolish and silly question, you must ask. Everyone has that. Hello, write some questions. Just sitting like a statue. How to close each session? Very good question. So in the book, for every chapter, I have mentioned one line which you should tell the client for follow-up so that they come to you next session. Plus, ideally, you can collect the fees for the next session before they go. Plus, you should tell them what you are going to do in the next session. Which method you will do, what is the benefit of this method, how you learned it. It has to be engagement, it has to be storytelling. Yeah. Give them next appointment. So if I have to say in one line how to close the session, so one statement from the book, then next plan, collect the fees for the next session preferably, and give them the appointment. Yeah. So next we will meet day after tomorrow. Next we'll meet tomorrow. Next we'll meet next week. Whenever the client wants. Good question. Next question, please ask. That's an interesting question. What if a deep buried trauma flare up someday and you don't want to face it, but it's affecting you? See, if it's a trauma, it was deep buried and someone did something, someone talked something that got flared up, or because of some emotions, weakness that got flared up, and it is affecting you. This will need healing now. One. The second part is it affected you the time you were weak. Your emotional bank balance was low at that time. So you will need to do certain methods which I teach you in Sunday class, psychodynamic, that helps you increase your emotional bank balance on a daily basis. Understand? So you have to protect yourself. See, people are waiting. The day you become weak, they will attack. Yeah. The day you depend on someone, they will betray. They will be unfair to you. So you have to protect yourself. Things are going to happen, but your mind should not be affected. But you are a human. Yeah. You are not a monk. You are not a god. Even monks also get affected. So you are a human living your life in this world. Plus, the most traumatic event is that you are married. So you are going to get affected, my dear. It is a part. So what you can do is you can bring your emotional bank balance so that if you were supposed to get affected this much, this will be reduced to this much. Okay. Apeksha has asked an interesting question. When we are doing counseling, should we give anything in writing? So what do you want to give in writing? What do you want to give them in writing, my dear? Okay. So I will give you a very real medical legal case. A client comes to you because they have been trained by their lawyer to produce a document. They have committed a murder. And they come to you and talk in a particular way which brings out certain diagnosis. Okay, either schizophrenic or temporary insanity, psychosis, bipolar disorder. And in your notes you may not have written the diagnosis, but you written something which brings out this, and you gave them this letter. So as per Indian law, they have not committed any murder, they can go free. Yeah. So who is responsible? Plus, if the this opposing party, they challenge what you are given, they will ask you, they will summon you in the court. The court will summon you to give expert testimony. Then everything will open up. Who are you? What are you? How many clients? Which test you used? What is the validity of the test? What is the specificity of the test? What is a beta value? Even the lawyer does not know what is beta value, they will still ask this question. Yeah. How you came to the diagnosis? Right? Okay, you are done the diagnosis, the murderer goes free. The second thing can happen is someone gets fired and then someone comes to you and uses this document to for the court battle to get reinstated. You understand? Someone has outburst. There is a marriage battle going on. Yeah, divorce battle going on, child custody battle going on. You don't know why someone is asking you. You understand? The only reason, the only time the client will ask you in the writing is some gadbad. If any client asks you, deny them. You say, I do not do that. If you want, I will refund you the money. If you want, don't take session from me. I will not do anything in writing because it is a medical legal issue. No, others are doing. You go to other. Who told you to come to me? No, I have paid you. You are to given writing. You have paid me for counseling session. I had never agreed that I will give you in writing. You are not purchased me. I will follow my boundary. I will follow my rules. If it is okay, okay. Otherwise, get lost. Take your money. Give them 500 rupees extra. Ask them to go to your competitor. Bhavya has asked an interesting question. 7-year child with all components of ADHD, how to approach, how to counsel the parents and the child. Why should you counsel the parents and the child, my dear? Unless the parents have come to you and say that there is a problem with this child. Okay, I understand that this is a case of probably someone in your family and you have diagnosed them after reading the book that the child has ADHD. You have no right to approach to the parents and convince them that your child has ADHD. Okay? Unless the parents have come to you and say that we need help. Plus, you cannot diagnose ADHD like this. Okay? This is a wrong diagnosis. I will give you an example. Around 10 years, both boy and a girl, they are in the same class. You are interviewing both of them separately. The boy seems like restless, moving arms and chair and little playful, joyous and all those things. And the girl is sitting quiet and maintaining balance. Most of the people diagnose the boy with ADHD, right, at this stage without further questioning. But you are a smart counselor, you are a good counselor, you are going to be a rich counselor, so you start asking questions. How's your friend circle? How you play with the friends? So the boy will say, I play very well, no problem. The girl will say, yeah, I fight with everyone, I don't play. I play individual games. Then how is your marks, right? Probably both may have average marks, both may have lower marks, doesn't matter so much. Now what kind of games you play? What you do? What is your favorite activity? Then you interview the parents, whether there is a frequent change of activity, frequent change of task, frequent change of games. Does your child typically complains, I'm getting bored? Yeah. Does your child starts a play and in the middle of the play they stop and start playing other thing? That is a indicative of ADHD now. Okay. But that is not a confirmative diagnosis because the 7-year is early diagnosis. Child is a child. Child is supposed to do all the foolish nonsense thing. Stupid thing. Let them enjoy their life. Let them have inconsistency. Let them have change the games. Just because you are troubled on their request that they want to change the game, you are labeling the diagnosis, or the parents are labeling the diagnosis. Wrong diagnosis. Then you are out, my dear Bhavya. Diagnosed by neurodevelopmental doctor in abroad. Just because the doctor is abroad, that doesn't mean the diagnosis is correct. Yeah. So first we will have to check which test they have used. Okay. So bring me the papers, send me and tell me if the mother is asking your help. And if they are already abroad, it means I'm assuming they are taking some counseling from someone else or that particular neurodevelopmental doctor's team. You are not in the picture. Right? But if they are still asking you your help, then you can read the book. There are 3 chapters on ADHD. ADHD for adult, ADHD for child, ADHD for adolescent. And how to manage the client, how to manage the child, how to manage the parents. Both is given. Tell them. Right? For knowledge, you will need to read the book. Good question. Next question, anyone? Most of the so-called abroad doctors, they are wrong. They don't have sense. They don't have time to do anything, any diagnosis or rule out a diagnosis. If you really want to rule out some diagnosis, then in this book, Float to Fly, you will find this is another program also, very costly. If you cannot afford that costly program, special education, the gifted child management, then you can read this book. there is an algorithm, around 25-page algorithm, which tells you if this is there, it means this is there. Then you go to next step, which tells you how to exclude the diagnosis. As a parent, as a teacher, as a counselor, you will be able to use this algorithm. Good idea, right? So you know now by this time the doctor is wrong. Probably that abroad doctor has diagnosed, mislabeled the child because of lack of time, or because of maybe they are getting more money from the insurance, or because they want to earn more money out of this client, right? So as a smart parent, as a good counselor, as a teacher, you will use this algorithm to find out which diagnosis is excluded. So when you use this, you will be able to exclude most of the conditions for the child. This algorithm works up to the age of 12 years. Good idea? Next question. Questions, you can ask any question. It may be related to the topic, not related to the topic, or maybe history taking, or some question you had in your mind while managing the client. Okay. So Supriya, send me the ticket. I will come to your place and I will kill you for asking this question. Vivo has asked a good question. Hey, what is your name anyways? Why don't you disclose your name? How to detect depression if all seems normal? So there is a ploy. People cannot be happy. Everyone has to be depressed. Everyone must have some problem. So if you are functioning normal, if you are seemingly happy, people want to put you in that cage. Hey, no, you are not happy, you are depressed. It is high functioning depression. What is your problem? Let that person be happy. Let that person diagnose themselves, come to you for diagnosis that they need help, right? There are people living in your office or in your family, and you want to put everyone in the cage. Hey, no, you have anxiety. Hello, you have trauma. You have PTSD. You are hopeless. You are narcissist. You are schizophrenic. You are bipolar. You are depressed. This is a ploy to make everyone as the patient, to remove your happiness from your life, to earn more money, unethical practice. I think you are not looking happy today. I think you need 5 sessions from me. Take one session and then we see. By the time one session ends, you are already the patient now. What is this? If someone is seemingly normal, it means they are normal. Why you need to be so much pessimist? No. Happiness does not exist in the world. Everyone must be depressed and unhappy. If the days you feel good and you are functioning normal, you are surprised. How come I am happy today? No, this is not normal. No. The purpose of human birth, human life is happiness in heart and peace of mind. It's not finding a reason to be unhappy. There are two types of people. Everything is good, but they will always keep trying a reason. What is the reason I should be unhappy today? And then there are people who everything is going haywire, but one reason to be happy. I'm alive. That is absolutely. I saw your smiling face today. That is my happiness. You know who I'm talking about. Supriya has asked incomplete question. Like I'm a chat GPT. 2 weeks of low mood and loss of interest. Uh, I'm sorry to hear that, Supriya. You will need psychotherapy, electric shock therapy, and psychiatric medications. So if it is Anita, she will talk like this. Because there is no happiness in the world, right? According to her. What is this? Supriya, my dear, if I am giving the answer, it is a part of life. Low mood because maybe something is there. You are burned out, exhausted, fighting with husband, fighting with children. Something doesn't go as per you. Health is not good. You are not eating properly. Stomach infection, gut brain axis gone, sleep disturbance. Something is there. Sometimes there is no reason. Yeah, you are on a low mood, loss of interest. 2 weeks, no problem. You will come back again. Don't worry. Now to come back again, you don't need to fight so much. No, no, I don't want to be depressed. I don't want to. No. So 2 weeks before, what you used to do, you had particular ritual, either ritual for your worship, own care, self-care, cooking for children, cooking for family, going out. Force yourself to do that. One time. You need to force yourself for one time only. You break the cycle. So the cycle is you feel low mood, you lose the interest, you stop doing things, and because you stop doing things, you are depressed. So at some stage you need to break this cycle. And then you start romanticizing your depression. Ah, nice. So Garima has asked if a person is not depressed because of a single event, but got depressed because of multiple events. Yeah. So marriage was not enough to depress this person. So people did something more horrible to them to make them depressed, to ensure that they are depressed, right? It happens with everyone, dear. So you are living a life where people are bad, where they are looking for your weakness, where they are looking to attack you, where life is unfair. You will get betrayed. You will have certain events in your life, independent of someone. Sometimes it may be self-inflicted. So you will suffer. You will have traumatic events. You will have crisis. You will have betrayal. You will face unfairness. You will feel that you are broken completely. It is inherent part of the life. But there are two options now. Either you become the villain, you stay, you romanticize, and you blame someone, or you heal yourself. You take some steps to heal yourself. You use psychodynamic methods. You do neuroplasticity to change your synapses, to change your neurons, to change your responses. You do experiential psychotherapy methods to overcome your traumatic event, to move on your life, to heal. All those things you learn in Sunday classes. So Dr. Parita is asking, can we teach some meditation techniques and all? I like this question very much. Under the meditation is a vague word. Under the name of meditation, you yourself don't know what you're doing. Someone might have taught you something and they themselves are not sure whether the transfer of knowledge is complete and correct. You might have assumed something. Your husband talks one thing and you understand other thing, you think third thing and you do fourth thing. That is single statement. Meditation is some method, right? If you are the person who understands different and talks different and does different and engages in the battle routinely, you will never, or anything for any matter. So you cannot be sure that what you have learned from meditation, what you have been doing is correct. You cannot be sure if you teach someone something, they are doing correct. Plus, there are certain techniques in meditation. If you do correctly, it will cause you anxiety and depression. Mindfulness meditation research you read. Why all the videos, all the top so-called people of mindfulness meditation, they have free videos? Because they know, because the research says 50% of the patient will become patient after following their methods. It's a ploy. You do the research, you check. Okay? So two people are doing free mindfulness meditation and one will become the patient. Many of the times there are certain meditation methods that further increases your depression. You will go blank face, flat face, emotionless. You will go dry and numb. You don't want to be dry and numb. So if it is a dry forest, it will burn. You don't want to be that. There are certain meditation methods which increases your worry. You keep on thinking of the thought and you keep on thought. You're not sorting it. So you should not teach those things which you yourself probably might be suffering, or you might have increased your anxiety and depression. You don't know that. It's such a vague word. Under that name, you can do anything and everything. And most of the things will be wrong. And even sometimes it is right, the 50% side effect is there. Bhava has asked an interesting question. Someone is obsessed with keeping a home crystal clean but not their self is considered OCD or not? I don't know the answer. So here the understanding is this particular client, Bhavya has, they do the cleaning and everything, but they themselves are dirty and they do not bath. It can be OCD with depression, correct? So self-negligence, loss of interest in self-care, but obsession for cleanliness everywhere. And fighting with people if you unclean it, right? So it can be OCD with depression. OCD people tend to fall for depression as well as anxiety. That is a battle they need to do. If they do this battle, manage this battle, OCD you can play it as a gift. Vivo has asked another question. Are suicidal tendencies and depression genetic? You should read the book for this answer, my dear. Yeah. Once you get the book, you read the book. Questions? Good questions. ये लो स्वाति तो एग्जाम मोड में बेचारी ट्रॉमा में है एग्जाम के टेबल. Even if the exam is easy, even if you have read the book, you are still like panic. Exam. Because since the childhood you have been brought up. Hey, exam hai. Hello, what's the big deal? I already finished my studies. I don't need to study for the exam. I will do the revision one time for 2 hours. End. I will sleep then. So, okay, after the exam, can we still attend your sessions? Swati, you WhatsApp me. I will answer you. Okay. So we have already done the exam brief for the previous batch. I have already sent you the video and the dates and everything. You follow that. After that also, if you have the question, you can always talk to me. Monday to Friday, 1 to 5 p.m. If you need any help after 5 p.m., go to your nearest hospital. Ruchira is asking interesting question. How do you, I will rephrase that because it's a complex poetic wordings. So, very complex Shakespeare English. So, Ruchira's question is, how do you maintain your sanity while managing these insane clients? Number one, you cannot become empathetic. So if you start putting yourself in their shoes and understanding what are you going through and start feeling the pain, you are already gone. You are going to end this session and fight with your husband and beat your children and shout on the neighbors. You don't want that. So you need to be detached, right? Consider the client as your friend. So if your friend is suffering and she is crying and she had a bad marriage, what do? You feel happy internally, right? You feel, wow, I'm not the only one who is unhappy in life. She's also happy. It's so nice. She used to, बड़ी उछलती थी college में, अच्छा हो, right? So same approach you maintain. Why need to get so much attached to the client wherein you are not attached to your husband, you are not attached to your parents, siblings, and your friend, right? As soon as you see your friend's Instagram beautiful photo of vacation, you feel so sad and depressed. And as soon as he calls you and say, my husband cheated on the vacation, you feel perfect. Tell me how it happened. And internally there is a smile on your face and your heart is so big now. you are going to go on a party tonight. Correct, you do that, right? So same, why can't you do with the client? So that is the easiest way to maintain your sanity. But I understand you are asking for some systematic and scientific solution. It is mentioned in the book. So around the chapter of history taking, before or after that, there is a title, How to Maintain Your Sanity While Managing Insane. Read that. Have you read Ruchira book? Reading it. Very good. Very good. Read that. Find that. Where is that chapter? Read that. So the index for the book is hidden. So you have to read the book to find the index. Good idea. Yeah. Otherwise, you will just go to the index and read the chapter whichever you like. Vivo has said a very good thing. You are your number one priority. Very good. Very good. What was the best part of today's session? The acknowledgement. Hey, according to you, what was your best part? Write down in the chat. What was the best part of your today's session? The acknowledgement that your happiness comes from others' miseries, especially friends' miseries. She is also thinking same about you. She is waiting for you to call and start bitching about your husband and crying about your in-laws and sufferings, and you are like a dungeon sitting in the dustbin covered with the cow dung. She wants to hear all those garbage and she wants to enjoy that. She finds pleasure out of it, and that is the only reason she is listening to all this thing. And when she calls you, she's trying to dump all the garbage on you so that you get emotionally affected, you empathize with her, and you fight with your husband and shout on the neighbors and children's, anyone walking on the street. You do that? Yeah? Someone walks on the street and you just shouts at them and snaps at them. You meet someone in the mall and you do the same thing. Someone bumps into you, you are like, kill them. It's because your friend is dumping her garbage on you. Don't blame this on your poor husband just because of this. He already is diagnosed with narcissism. When you read the book, you will find that most of the conditions, they are present in you, right? So you will have all the victim conditions, anxiety, stress, depression, especially after marriage, and all the ADHD, OCD you will find in your children, and all the horrible conditions, narcissist personality, bipolar, you will find in your husband, and the most horrible condition of all, schizophrenia, always mother-in-laws, invariably they have schizophrenias. They are very paranoid kind of thing, very controlling paranoid. So you can use it for battles whenever you have fight. Make sure you use the diagnosis properly so that you learn. That is the best way to learn the diagnosis method. And don't be so sincere that writing notes and all. No. So just pause your fight, read that chapter, find the diagnostic symptoms and say, see, this is your diagnosis, confirm. And see, because of you, my diagnosis is anxiety and depression, all those things. Why, Sandhya, you are so serious today? Her husband is traveling, so she could not fight with him. So we understand, sympathize. Because of work, so she did not get a time for a daily dose. Any next question? Now, many people think that, sir, children are not listening, adolescents are not listening. Hey, when you were the child, you were not listening. And the time to build their bond, to build their trust has already gone. But anyways, if you still want them to develop a stronger bond with you, you want to develop a stronger bond with your children, with your parents, with your own, read this book, Letter to Student. Okay, it is meant for the parents and children both. Each page is 30 seconds. Randomly read any page You will find one page that will bring tears in your eyes. The purpose is done then. Yeah. Go to Amazon, search this book or search my name, Dr. Pawan Mittal. Once you read that book, tell me how you liked it. Once you finish that book, I will give you the cashback of full amount reading the book. Good idea? If you have elderly parents, okay, we will talk about that later. Very good. Write down the chat. So after my geriatric book came, Chitra called me and said, "Sir, should I buy this book because my parents are living with my brother in Australia?" So I said, "What is your age? Uh, you are now in geriatric population. You should buy this." So you do not understand, Sandhya. Sandhya is asking interesting question. How do we understand who needs what kind of meditation? You cannot understand because there is no proper documentation for that, right? So why this question you are asking? Because you do not know something beyond meditation, right? There are more things beyond meditation. Experiential psychotherapy, psychodynamics, neuroplasticity. Once you learn that, this question will fall. You understand? Someone who can jump from the swimming above top in the swimming pool, they will not ask the question, how will I swim? It is inherent. They can swim. They have mastered the new skill now. So because your present knowledge is limited, awareness, that's why you're asking this. So it doesn't work. It doesn't help. It might be harmful for you. It might be harmful for them. Plus there is no documentation. Plus there are a lot of research which says that it doesn't work and meditation increases anxiety and worries and depression. You start romanticizing your depression. All those people those who do meditation, if you are doing wrong way, you will sense that your emotions have got flat. See your photos recently and few years back. There are people who have a lot of troubles, but their emotions are live. Yeah. Even if they cry, there is emotion in that. Sunday, you talk to me tomorrow about psychotherapy program. Questions? Enjoyed the class? So you can be in touch with the mentors allocated to you. If I'm your mentor, my timing is Monday to Friday, 1 to 5 p.m. If you need any help, you can drop me a WhatsApp, then I will talk to you. If you need any help after 5 p.m., please visit your nearest hospital. Thank you. Have a great time.